today I'm going to be talking about food protein induced enterocolitis syndrome, also known as FPIES. So FPIES is a little bit different than regular food allergies because it only impacts the gastrointestinal system, causing stomach symptoms, rather than with regular food allergies. You can also get like hives and like swelling and difficulty breathing. So some symptoms of FPIES are like vomiting, diarrhea, abdominal pain, and it can also cause dehydration. Symptoms rather than food allergies for FPIES, it can take 1 to 4 hours for symptoms to appear. Meanwhile, with regular food allergies, it happens like within like the first few minutes after you eat something. Most of the common food triggers for FPIES are like dairy, rice, soy, eggs, wheat, oats, corn, and potatoes. A reaction for FPIES typically lasts 12 to 24 hours if it was something you only consumed once, though if this was something that you were consuming regularly, it's going to take like days to weeks for the symptoms to end once you've taken that item out of your diet. So diagnosing FPIES is a little bit more difficult than for regular food allergies, because for food allergies, you can get a diagnosis through a blood test or a skin test. Though with FPIES, since it only impacts your gastrointestinal tract and it's only dealing with your stomach, then you're not having any like skin symptoms, so it's not going to come up on a skin test. And then with blood tests for food allergies, it is measuring how your antibodies react to certain foods. And FPIES your antibodies don't react to the foods that you're allergic to through FPIES. So it doesn't come up in those tests. A way to diagnose FPIES is through an elimination diet, blood tests during an actual reaction to see what's going on in your body when you're actively having symptoms, or like an oral food challenge. This is something I would encourage you to talk to your doctor or allergist with if this is something that you're concerned about, to see what you should do personally. FPIES is something that mostly like infants and young children have, and they typically grow out of it by the time that they're 3 to like 5 years old, though it's still something that can go into adulthood or you can get when you are an adult. So because roughly 2 in 1,000 adults do have FPIES, and FPIES is something that a lot of people don't know about, and it's hard to get a diagnosis. Thank you for watching.